This may surprise you, but not all hair loss is the same. And there's one type in particular where recognizing the signs of the hair loss early can make all the difference. Hi, I'm Dr. Scott Walter. I'm a dermatologist and hair loss expert. The type of hair loss I want you to be able to recognize early is called androgenetic alopecia, or AGA, also known as female or male pattern hair loss. It's the most common type of hair loss in both men and women. And recognizing it early can make a huge difference because if you start treatment early, you get to keep the hair you have and sometimes get regrowth. But how do you know if you have this type of hair loss? Let me explain. Here's what I look for during an alopecia exam. For women, the hair loss primarily affects the crown. So one of the earliest signs is a widened midline part. So if you part your hair down the middle, you see a widened part compared to the part in the back. This hair is never affected with patterned hair loss. It's always up here. For men, we look for receding or thinning hair in the temples or vertex. I also use my dermatoscope to take a really close look at the scalp. Here I'm looking for miniaturization. So if I see miniaturized hair follicles, so much smaller in diameter than a normal hair follicle, that is a sign of genetic hair loss. I also do something called a pull test. This is to diagnose telogen effluvium, but if it's negative, that can be suggestive of genetic hair loss. So that's when you pull a bunch of hair at once and see how many come out. If a ton of hair comes out, that likely means you're dealing with temporary or telogen effluvium stress-induced hair loss. And then we also consider things like timing. Has this been a slow, gradual process, or did it start all of a sudden? A positive family history and a gradual onset can both indicate genetic hair loss. So if you're noticing your ponytail getting thinner, a widened midline part, thinning temples, see a dermatologist. The treatments we have are supposed to help keep the hair you have, and sometimes we get regrowth. The earlier you start, the better. If there's interest, in my next video, I'll explain my treatment ladder where I go through all the different treatments I offer to my patients when they come in with this type of hair loss. But for now, let me know what questions you have.